Thank you, Mr. Chairman. What I'm worried about is that the world is experiencing the largest global decline in decades in the number of children receiving basic immunizations. And there was a time that, thankfully not my generation, though I remember lining up for that sugar cube, that there's still people alive that had polio. And polio's coming back, measles is coming back. And misinformation about vaccine safety has fueled distrust of long-trusted, safe, and effective vaccines. There's a lot of misinformation out there, so I want to make sure that we amplify what's accurate and what's life-saving. And I'm going to tell you something. There's nobody here that's more afraid of any kind of injection shot or vaccine than me. I had Guillain-Barré from a swine flu shot, and I'll never forget what it was like to be paralyzed. And I have been to, people have said, you don't have a flu shot, you can't come. And I'm not getting a flu shot because I'm never going to have what happened again. And I was scared to death to get the COVID vaccine. But I talked to people. I talked to a ton of people. And the infectious disease doctors that I talked to, some were at Michigan, but I was lucky enough to be able to talk to 20 of them because I was scared. And they all said to me, your bigger threat is getting COVID than not getting this. So I researched it, and what they told me is that this was developed a set way. It doesn't have a live virus. You need to look at getting, you will be safer if you get this COVID vaccine. If we're going to talk about vaccine safety, then our conversation should be, and I respect all of my colleagues on this panel, and I've said to them, I'm worried people aren't getting their vaccinations. They're on the ground, they're facing rising vaccine hesitancy, they're seeing people not get their measles, their polio, et cetera. So I'm going to go to Dr. Lynch and say, as the practicing physician on this panel, I'd like to ask you to describe the positive impact COVID-19 vaccines have had on your patients.
The impact has been massive. We went from a position of great fear in 2020 to some feeling of response, both at the health system level, healthcare worker level, but also among my patients. We all, if we're careful, think about the fear that we were experiencing in 2020, the amount of unknown, and the COVID-19 vaccines were the first tool we had to combat both infection, but also the most feared consequences of that infection, namely severe disease, putting you in a hospital, and dying from that infection.
Republicans, including members of the subcommittee, have said that the COVID-19 vaccine is unsafe. For example, they've suggested that the mRNA vaccines were rushed and therefore pose a risk to people's health, when the truth is that the approval process was thorough and vigorous, and that the mRNA technology has been in development for more than 15 years, which I heard from the 20 doctors I talked to before I did get this. Dr. Lynch, your written testimony states very clearly that the risks associated with COVID-19 infection are far greater than the risks associated with the COVID-19 vaccination, which I heard from many of your peers. Can you debunk some of the more egregious trends of COVID-19 vaccine misinformation and confirm that COVID-19 vaccines are safe?
Absolutely. The safety of the COVID-19 vaccines is indisputable. It has been given to hundreds of millions of people. And in fact, some of the databases that Dr. Bardosh referenced in Israel and UK have demonstrated that at the country level, as well as data from the United States and many other countries. These are the most powerful and safest tools, and far, far exceed in terms of the safety profile versus the actual act of getting infected and all of the downsides of that, ranging from serious disease, death, long COVID, and even some of the more feared complications in children like the multi-system inflammatory syndrome.
So in the United States, vaccination rates for preventable diseases like polio and measles have not bounced back to pre-pandemic rates because of misinformation. Declining vaccination rates are driving dangerous outbreaks of infectious diseases. In the last year, there have been outbreaks of measles in Ohio and Michigan and polio in New York. Last summer, I wrote to the Health and Human Services because we were experiencing an Mpox outbreak in my home state of Michigan. Dr. Lynch, how is vaccine misinformation harming the public health? And then I'm going to throw in one last question. Are flu shots dangerous? Because I had Guillain-Barré. Should nobody get a flu shot?
So I'll answer the first question. Misinformation from any source weakens vaccine confidence, which could lead to more people to not being vaccinated. Not enough people are getting COVID-19 boosters, which means we are not as protected from COVID-19 hospitalizations and deaths and the impact on health systems. Declining vaccine rates from diseases like measles, pertussis, and polio are causing outbreaks that are not only dangerous from a public health perspective, but have profound economic consequences for our society and the families involved. And yes, I think that everyone should get a flu vaccine every year.
Except for people that have had Gansbury. Thank you, and I yield back, Mr. Chair.